Welcome back. Today we're talking about substance use disorders, and joining us now is Jessica Shortridge, a licensed addiction counselor at the Rocky Mountain Treatment Center of Great Falls. Thanks for being on our show today, Jessica.
Good morning. Thanks for having me.
Yeah, of course. We're happy to have you. So let's start by saying, what's the difference between someone who is an alcoholic and someone who likes to drink? Are there characteristics there that you can pick out that lets you know for sure this person has a problem?
Absolutely, and they have to meet criteria through an evaluation that's extensive, that we're looking at biological, psychological, physical, environmental factors. However, a person that is not an alcoholic isn't going to question if they do have a problem as an alcoholic would.
Okay.
Two major questions to ask is, one, has my use caused any major life problems? And two, if I realized that my using has caused major life problems, was I able to stop using?
Okay. So if someone does drink only a few times a week, but when they do, it is excessive, is that person an alcoholic?
They very well could be. Again, it's what kind of problems is my using causing? And once I start, am I able to stop? And that really doesn't matter if it's someone being on a drinking spree for a week and going without months at a time. If they're drinking 3 or 4 drinks on a daily basis, it's really looking at what problems my using is causing me, physically, emotionally, spiritually.
Okay. And so if someone does have a problem, whether it's alcohol or drugs, why is it so difficult to ask for help?
As human beings, we really struggle with asking for help, and that's one of the things that I push is that we are learning how to be able to ask for help. Nobody likes to believe that they're different from others. It's socially acceptable. Alcohol is everywhere, so it's a real struggle to ask for help. I can do this on my own. I don't need help. All of those factors tie
Independent.
into that. Yes.
Yeah. So if someone is suffering from alcoholism or has an addiction and decides to go into inpatient treatment, what can that person expect? What is that like?
Sure. I tell our clients all the time, there's only one thing that needs to change, and that's everything. We are addressing the person holistically, mind, body, spirit. We're implementing structure. Education is power. So educating on the severity of this disease, educating the tools that are available, and then the most importantly is practicing implementation of those tools, because we've been using what we practice.
And so what's the difference between inpatient treatment and outpatient treatment?
The intensity, the level of accountability and structure. Time is a factor. You know, there's 20 hours of therapy on average a week in an inpatient setting. Outpatient, the requirement is 9 contact hours a week, and that's typically going to be 8 weeks. So we can't stay, our jobs didn't keep us sober, our families didn't keep us sober, our houses didn't keep us sober, our bank accounts didn't keep us sober. Recovery has to come first.
Okay. And so if someone is getting treatments, what can they expect? What are some of the methods that you use to treat people?
Absolutely. The most dangerous place for us to be is in our heads. And so we're working on our thinking errors. We're working on identifying our feelings. This is called the feelings disease. If feelings are in control of us, we're out of control, and we need to learn to identify what those feelings are and change our behaviors. So we go through lectures, there's group, there's individual treatment, there's our family program, and then equine therapy.
Okay, so can you talk about that a little bit? What is that? What's equine therapy?
Our equine therapy, I'm more of the interpreter of what our clients get to experience with the horses. We're working on rigorous honesty. They're working on immediate biofeedback. The horses look right through our powerful behavior of wearing masks and putting on facades. They build self-confidence and self-esteem because they're working with a 1,000-pound animal. And if they can be successful with self-efficacy on learning how to put a halter and lead rope on and lead a horse around, it's a huge benefit to their self-esteem to help. If they can conquer and overcome those fears, they can do way more than that in life.
That is cool. So you talked about that your family didn't help, your job didn't help. So talking a little bit more about the family, what role does the family play then when it comes to treatment?
The family plays a huge role. This is a family illness, and this is a WE program. Our families typically are huge enablers, so they're continuing to facilitate the disease rather than facilitate recovery. So families being a part of the recovery process, getting involved in Al-Anon, it's a free program, getting connected, knowing that they're not alone in dealing with this disease, talk about it. This disease, again, the statistics are outrageous on who it all affects, and getting educated on what enabling is, what rescuing behaviors are, how to do things differently, and love the person, hate the disease, but facilitate recovery.
Can you talk a little bit about how your personal experiences have affected the way that you've been able to help others?
Absolutely. I've been in recovery from alcohol, methamphetamine, marijuana, opiates for over 11 years. And so I have the experience with the background of that. Been there, I've done that, and I can help walk through the struggle and get to the joy of being in recovery. That I tell our clients all the time, I will go through the blood, sweat, and tears right alongside of you. I'm not going to work harder than you do, but I work just as hard as you want to, in addition to the education that I've received to become a counselor.
So we just have a little bit of time left. Really quickly, if someone's watching and needs help, what's your advice?
Yep, get out there and ask for help. The time is now. Don't procrastinate. Don't wait until you're in the emergency room. Put the shovel down. You've hit rock bottom, and it's okay to ask for help, that you're not alone in this.
Perfect, Jessica. Thank you so much. Appreciate your time.
Thank you.
So we need to pause it for another break, but up next, we'll be talking to a graduate from the treatment center in Great Falls, and we'll be right back to talk with her after this. Stay tuned.